forward and backwards. Now I've already done Raquel's orthopedic neurological evaluation. Back to neutral. So see, I can tell she's a side sleeper because her head's forward and turned a little bit this way. Is that the way you sleep most of the time? With your head turned right? Yep.
Yep.
Okay, so you see you have a little bit of translation to the right. And when we look down here in the pelvis, see your pelvis is shifted to the right a little bit more and it's elevated over here. So that's why that's hurting in your SI joint. Okay, I'm not going to redo all the tests that we did on you, but let's lay down here and I'll show them a couple highlights. One of the best ways to evaluate sacroiliac joint subluxation or biomechanical distortion or improprieties is check the leg length. Now her left leg is a half an inch shorter than her right leg in this position, right where the sole and the heel meet, where the white and the black meets. Now as I bring her legs up, if you'll notice, it actually gets longer. That tightens up right there, doesn't it? Mm-hmm. Yep. So I did a palpatory exam on her pelvis, and she has definitely swelling and pain on this right SI joint right there. Is that tender?
Yep.
And then also down here on her ischium on the right is sticking out a lot more than her ischium on the left. You feel that more so there than this one?
Yes.
Yep. And then this sacral deviation test, go ahead and lift your right leg up. Now see, that's hard for her to do. That hurts, right?
Mm-hmm.
Okay, relax. Do the same thing on the left. But see, her left one also doesn't go up as high as the right one, so she's got basically a sacral deviation bilaterally. So those are the highlights of her orthopedic neurological test. She had normal reflexes plus 2 equal and active upper and lower. So I'm going to start off adjusting her left SI joint. You get the easy job, Raquel. All you got to do is lay there and breathe. Okay. And then your right SI joint. Now this will be a little tender to touch at first. Now because your ischium's so far rocked back, I'm going to adjust that too. And then your sacrum straight down. You're going to get the center of your sacrum here lined back up with your lumbar spine. There's L5. There's L4. L3. L2. Okay. Now I want you just to breathe normal and exhale for me. Okay. Yep. That's it. That's it. Yeah, you still got one right there. But let's recheck your leg length now. And see, you're exactly even now. See, the black and the white where it meets is exactly even now. And Raquel, tell me if this feels any easier than the first time I did it.
Yep, a lot.
Yeah, good. So your legs stayed even that way too.
Mm-hmm.
Okay, you're gonna feel your head popping up a little bit on this one. That's it. Okay, let's turn you on your back now.
Ooh.
Yep. We're just getting started today. Okay. So remember I told you your head was a little forward?
Mm-hmm.
So I'm going to bring your head back up over your shoulders where it's supposed to be. Up and back. There you go. Okay, now I want you to put your arms straight out to the sides, palms facing up. Yep. I'm going to adjust your shoulders, your clavicles where they attach to your sternum, and then your interior ribs right here. These might be a little sore at first. There you go. Now, I want you to just relax your leg in my hand here. There you go.
God.
Now you should have felt that from your ankle all the way up to your right SI joint, did you?
Yeah.
Okay. Relax this one too. That girl.
Jeez.
Yep. Okay, because of your pelvic rotation, I'm going to adjust your interior hips here too. This is the anterior superior iliac spine right here. That's the left one. I'm going to do them both. There you go. Good. Okay. Now let's set you up face towards Renee. That girl. Feel like you got a workout?
Yeah, I don't know. Something.
Not sure yet. Huh? There we go. Crack addicts gonna love you. That's what we call our YouTube fans. They're all crack addicts around the world. They get off on the cavitations and
man.
noises. There we go. Look at you. Noisy all over. There we go. This must be National Tattoo Day. We've had lots of tattoo ladies coming in today. Okay, let's come over here on your back on this table. Now I'm going to pin both your pelvic bones down. Remember how I told you your right one was high?
Mm-hmm.
We're going to level that out now. So go ahead and lay right here with your butt, head up this way on your back. There you go. Yeah, and I'm going to lock your pelvis in here, slide up just a little bit. Yep. There you go. That feels pretty tight, doesn't it? Yeah. I don't want you to get away. I just do this for demonstration purposes. I'm not doing this to make sure the patient's still alive, like some of y'all say. But I just show the difference in the reflexes. Now see, she's got pretty good reflexes on the left one, much more so than on the right one. Do you see the difference?
Yeah.
Now, this is how you should start sleeping with your legs elevated like this. This will relax your lower back and pelvic muscles and take the pressure off down there.
Okay.
No pillow under your head either, by the way.
Yeah.
Okay, lay your head back. Keep your teeth together. Just breathe through your nose. Mm-hmm. Atta girl.
Oh my God.
Now, you should have felt that all the way down to your pelvis, did you?
I don't know. I felt it all the way down.
Somewhere,
Yeah,
huh?
here. Mm-hmm.
Okay, relax. Look at that. Great. Look at that one now.
Mm-hmm.
See the difference?
Yeah. Weird.
Pretty cool, huh? That's it. Yes, ma'am. Told you the crack eggs were gonna love you.
What have I been doing?
You haven't been coming here.
No.
You're in the right spot now.
Mm-hmm.
All right. Let me help you up sideways here. Kind of get up sideways all the time. You don't ever want to sit straight up.
Okay.
Okay, stand right here in front of the mirror for me again. All righty. Should feel a little less pressure already.
Yeah.
Okay, let's have you close your eyes again and bend your head forward and backwards for me again. And back to neutral. Take a look in the mirror now compared to before. Look how your shoulders are squared off better now.
Mm-hmm.
Look at the spacing now.
Yeah.
It's more equal.
Yeah.
Shoulders are level, your head's up and back more. But here's your homework. You lift your shoulders straight up.
Lift them up.
Straight up. Yep. Now pull them back simultaneously.
Mm-hmm.
Flare these back like that. See how it tightens up that whole trap?
Yeah.
Okay, now your head's a little forward, so we're going to bring it straight back. And then I want you to look at the wall behind you. That much extension. You'll feel that all the way down your low back. Yep. Good. Okay, now relax. Yep. Now, just flex your head forward and backwards again. That should have felt smoother than the first time.
Yeah.
Feel like put a little WD-40 in there? Good. So, Raquel, everybody always wants to know what the very first time spinal decompression feels like. What would you tell our YouTube fans out there that feels like, first time?
Like being thrown into a box of rocks.
Does it feel better right now, though,
Yes,
than when
yeah,
you walked
no,
in?
definitely. Just a little scary.
Yeah.
But
Yeah, I don't have any heads on my trophy wall yet. I won't start with yours. If I had anybody's, it would be Renee's. All right. So how's your low back feel right now in your SI joint compared to when you walked in the door?
A little more tender, but
Okay.
I feel like that's probably normal.
Sore. Yeah, you're going to be sore.
Mm-hmm. But everything else feels way more.
You lighter?
Yeah.
You feel straighter as far as
Mhm.
standing up? Okay,
Mhm.
good. Okay. So, this is how we treat a patient with sacroiliac subluxations and misalignments and biomechanical improprieties. But you notice I didn't just adjust her SI joint, I adjusted her entire body to line all of it up, because if you don't adjust everything, this will go back out of place quicker. So we're going to teach